We are being as nimble as we possibly can to respond to what's working, to what perhaps isn't working as well as we had hoped it would. And we will always need to adjust every step of the way as new information comes in.
Well, that is the Prime Minister from just a couple of hours ago talking about COVID-19 test kits from Spartan Bioscience. Now, the federal government, Ontario, Alberta, and Quebec, they all ordered millions of dollars worth of the portable machines that can detect the virus in as little as half an hour. But problems were found with the swabs used to collect the samples. So now the company is recalling their product for more clinical testing. Well, the federal government also announced a new supply council to find solutions to ensure there is enough protective personal equipment as provinces begin to reopen. And for more on that announcement and the issues around testing, we have invited to the program the Minister of Public Services and Procurement, Anita Anand, joining us from Oakville, Ontario. Minister Anand, thank you for joining us.
Thank you so much for having me, Michael.
Now, listen, obviously PPEs continue to be a big issue. We're going to talk about that in a moment. But I do want to, first and foremost, address the concerns around the Spartan Cube. What impact will this delay of the Cube have on Canada's testing capability?
Let's be clear, there are millions of Canadians that are going to be able to be tested the traditional way, and that is happening on the ground every single day. The Spartan test is the rapid test, and in truth, we were not expecting it to be ready this week or even this month. It is part of the process of building new technology, and part of that process is making sure that the technology works before it is distributed and utilized. And so I am not surprised at all, and recall that it is going to be able to be used in the research setting, and Spartan will continue to refine the product until it is able to be used in the testing and more public environment.
But I think the concern here is certainly almost twofold, because one, you have a province like Ontario, which many critics say is not testing enough in order to secure a safe reopening of the economy. And then there are remote communities that are not so easily accessible to the traditional testing. How are those issues affected by this delay in clinical testing for Spartan?
I want to be clear that Health Canada last week did approve 14 new different types of tests, and so the delay that you're referring to is one that isn't actually a recall or a delay. It is part of the process of building new technology. Now, the point that you raise about vulnerable communities needing to be tested and needing to have access to tests is an important one. And in that vein, I would like to highlight that we did sign a contract with Lumen Ultra this week for the production and dissemination of 500,000 tests per week into March 2021. So we are diversifying our supply chains. We're diversifying the ability to test and the ways and means that we're going to be using to effect tests. The Spartan test is just one piece of that diversification story, and we are making sure that millions of Canadians are going to be tested, including in vulnerable communities, as you suggest.
Okay, let's move on now to personal protective equipment. Of course, continues to be of huge demand right across the country, will be of greater demand as well as provinces reopen their economies. So how is the task going in terms of trying to secure more PPEs?
Let me be clear that first and foremost, the federal government's priority is to secure personal protective equipment for frontline healthcare workers. That remains the priority, and we are purchasing and procuring every single day for that very purpose. As we move into additional stages of the pandemic, and as you say, reopening the economies, additional questions come up about the distribution and procurement of PPE. First and foremost, that's a conversation that the federal government is having with provinces to ensure that there is a collaborative approach going forward. Second of all, provinces themselves and even individual businesses and healthcare centers are procuring PPE on their own. As I have said from day one, this is a Team Canada approach. We are all in this together, and I, with my federal colleagues around the table, will be working with our provincial and territorial counterparts as we move to additional stages of the pandemic and how to address PPE needs in other sectors.
Minister Anand, I want to thank you for the time.
Thank you so much, Michael.